Good morning, everybody. This is the committee meeting of the Health and Wellbeing Board on June the 11th. And the first item on the agenda is the election of Vice Chair. I'm in the chair this year as the lead member for adults, and the lead member for children do a swap. So it's my turn this year. So the election of Vice Chairman, could I have a proposer? I'd like to propose Councillor Williams. Could I have a seconder, please?
I'll second that.
Thank you. All those in favour? Thank you. Thank you, Joe. Okay.
I'll just check no other nominations.
Oh, sorry. Any other nominations? No. Thank you. Declarations of interest. Anybody? No. Consideration of the draft minutes of the previous meeting held on February the 4th, 2026. Any questions? Could I have a proposer, please, to... thank you, Councillor Rogers. Seconder, please. Thank you, Councillor Wins. All those in favour? Thank you. Come to the first item on the number 4 agenda item, the Better Care Fund. I'd like to ask our Director of People, Sue Butcher, to present this paper. Thank you, Sue.
Thank you, Chair. I will give an overview of the paper, but also refer to Darren DeLint, who's the Head of Service for Adults, who has done a lot of work to bring this paper to the attention of the Health and Wellbeing Board. So this paper is asking for ratification of decisions that were made by our Chief Exec, the Isles of Scilly Chief Exec, which are to approve the submission of the Isles of Scilly Better Care Fund plan to NHS England, to delegate to the Chief Executive Officer in consultation with the Chief Exec of Cornwall and the Isles of Scilly Integrated Care Board for the submission of the quarterly and end of year BCF Care Fund returns to NHS England. So the background section of the report sets out the BCF's requirements and the NHS and local authorities to pool budgets to deliver more integrated services. And for Cornwall and for the Isles of Scilly, the approach is one of a combined plan. And that combined plan is to streamline and minimise duplication of effort. The plan is then submitted to the Health and Wellbeing Board in each authority. So the combined plan remains focused on continuing to deliver the objectives, priorities and schemes for the provisions agreed in the neighbourhood plan. Paragraphs 2.2 to 2.5 set out the engagement and the consultation, collaboration undertaken to produce the plan and the continuation of the expenditure profile. There are 3 performance measures set out in section 3. So it's how well are we doing and how well do we know we're doing? And they are around emergency admissions to hospital, the average length of discharge delay for acute adult patients, and the third one is the rate of people aged 65 plus who need residential or nursing care. That one, however, is not applicable to the Isles of Scilly, but as you know, we do have one care home for our residents, which is 12 bedded and is moving up to the integrated care facility. For financial implications, the Isles of Scilly 2026 Better Care Fund plan reflects an increase in funding for specific areas of contractual uplifts or new contractual arrangements to meet the tenants that are set out in the plan, and that's set out in section 4.2. For legal implications, it needs to be noted that the Isles of Scilly Health and Wellbeing Board couldn't be arranged in time for the statutory submission. That was the date of the 19th of May. So that's the decisions were then delegated to our Chief Exec Officer, hence the need for ratification from this paper. And if I could just refer to Darren, is there anything, Darren, that you would like to add?
No, thank you, Sue. I think we still, giving our limited resources and the size of our island, I think we still managed to do reablement really well. There's some challenges around respite care, occupational therapy services, but we're working with health partners to try and overcome that and come up with creative solutions. But nothing else to add, Sue. Thank you.
Thank you.
Thank you, Chair.
Any questions? Councillor Williams.
Not really. Well, I think it will be a question. So my main observation is this seems to be about reducing need for long-term residential care. There's also a good element for recruitment and retention of staff, which as a council we know is challenging for us. So I guess my question is, how do we know in 6, 7, 8, 9, 10 months' time the impact, the outcomes this has generated? How do we know that it's created sort of value for money and delivered on what we hope it delivers on? I assume we get some sort of end-of-year report feedback that just is able to summarise how this has created better lives for some of the individuals it's been supporting.
My view is that the metrics are the way that we do that, and regular reporting to the Health and Wellbeing Board, and the lead member here asking those questions and holding us to account, but also working very closely with Cornwall. But Katie and Darren may have other points that they wish to raise.
I just think it's a continual drive to push down the average day spent in hospital, Sue, and we've received those metrics from health partners as well. So that would be and the reduced numbers of hospital admissions, where we found an alternative, I think is the key metric for assessing success, Councillor.
I also think there's something, Councillor, around talking to residents and talking to the people who are, I mean, we've had good consultation as part of bringing things together, but I also think there must be something around the voice and views of our residents.
Thank you. Any more questions? Anybody else? We'd like to take the recommendations. Recommendation 1, that members ratify the following decisions made by the Chief Executive Officer of the Council of the Isles of Scilly under Standing Order 34. Approve the submission of the Isles of Scilly 2026-27 Better Care Fund to NHS England, for delegation of authority to the Chief Executive Officer in consultation with the Chief Executive Officer of the Cornwall and Isles of Scilly Integrated Care Board for the submission of the quarterly and end-of-year Better Care Fund returns to the NHS. Could I have a proposer, please? Thank you, Councillor Rogers. And a seconder? Thank you, Councillor Williams. All those in favour? Thank you. That's unanimous. Thank you very much, Sue and Darren. Neighbourhood Health and Wellbeing Interim Engagement Feedback, agenda item 5. Who's going to, Kate, what's yours? Right, who's going to go first? Juliet?
Would that be all right, Chair, if I started off? So Lucy is here with me as well. Actually, we're both at a conference, so apologies if it's quite noisy. We're trying to be quiet in a booth. So Chair and members, this was early. We're bringing to you the early findings from an event we did back in May. So it is quite hot off the press, so to speak, and basically, we thought it would be a very good idea to come and kind of show you the approach that we've taken, which has been very much around co-designed. We thought we'd then do a bit of just pick up some of the themes that come out through our conversations with Salonians when we were over there. And then I'm trying to get Chris to kind of join us, Chris Mitchell from the neighbourhood team, to talk about some of the things that are in train already, which addresses some of the feedback we had, but we also heard some new things when we were out talking to people. Lucy, would you like to kind of share the approach we took around the engagement event?
Thank you, Juliet. And for everyone, my name is Lucy Tewson. I'm the Director of Experience and Engagement for NHS Cornwall and Isles of Scilly. And Juliet and I are familiar visitors to the Isles of Scilly as we come over to visit and do an engagement event every year since I've joined in 2023. And so we were really pleased to come over again for an extended visit. And we work with colleagues always to organise closely with our Council of the Isles of Scilly colleagues, but also Health Watch Cornwall and Health Watch Isles of Scilly, whenever we plan engagement. And this year, as part of a neighbourhood health approach, we wanted to go even further and farther with our partners. So we were really pleased to join with colleagues from across the council, both in adult social care and children's services, Active Scilly, the neighbourhood team. So that included those people delivering services on the islands in your GP and pharmacy and the community nursing, as well as NHS colleagues from across both in Cornwall and the Isles of Scilly. We had an extended visit this time, including visits to 4 of the off-islands, so Briar, Tresco, St Martin's, St Agnes and St Mary's, as well as an online workshop. And we're running an online survey which will run until the July. So as Juliet mentioned, this is an interim report and we will update once the survey closes completely around later this summer. We also went out and about to speak to local people where they were, so in their places of work, at activity sessions and a stay in place session that the council run with local mums and children. And so we had a real variety of different ways that we spoke to people. We had some really good support from local Facebook groups for the Isle, so we were able to really actively promote using existing communications channels. And we also sent text messages to patients that are registered with the GP practice, as well as posters and flyers. So we try to be as inclusive as possible. And it was a real privilege to come over and speak to so many people and really hear some heartfelt stories. So we've got audio and film clips, which we'll use and share and add to the report. And we're happy to bring that back at a later date. Thank you.
Thank you. Any more?
Thank you. So sorry, Chair, do you
No,
want me to
carry
carry on or do you want to open it up to the floor for questions?
Yes, okay. Any questions? Councillor Roger? Oh, Kate?
I just wonder whether it would be worth sharing what we heard before we launch into the questions. But I think Juliet probably was about to go on just to give an overview of what residents told us and then maybe open it up.
Okay,
Yeah.
yes, right, fine.
That'd be lovely, thank you. So I think from the paper you'll see some of the key themes. So access and transport, which we know does cause a lot of stress and anxiety for the residents on the island and the off island. I think what we did hear more from is because we went out to the off islands, more of the challenges around getting from them onto the mainland and the transport cost as well associated with that, which was £80 each way. So that was an added burden that people told us about. The coordination of services, I think that was a very big message that we heard, is people coming over and coming back for one thing and then literally within a week we're asked going back to the mainland for something else. So that coordination piece that came out very strong. That financial burden, I think we heard that a lot, especially on the off islands, I think, and how to navigate our system was very complicated and complex. We had heard some things around some of our service gaps. So especially for some of these things where we heard from mums, and we heard some around some of the vaccinations that we could have done on the off islands if we just organised it differently. So we definitely heard around that. Inequality, I think we just, from going to the off islands and listening to people around, even between them and and St Mary's, saying that they felt that it was an inequality for some of the services, and then to the mainland as well. We heard a lot about the cost of living, around some housing issues and access to healthy lifestyles. So there was lots of things going on, but often not accessible for those people living on the off islands. And they really wanted to be able to go, what can we do for ourselves? So I think we've got some really good ideas as well and solutions that came forward. And then I think there was something around a lot of issues digital, and I think we heard that people would prefer an in-person presence to be able to talk to somebody. So we definitely heard that. And then also around availability of fruit and vegetables, especially in the winter months, that came across very strong. What would make the best difference for most people? There were some really strong themes across the St Mary's and the off islands. Better coordination. We had really good feedback about your primary care and the minor injury unit, but it was the coordination and availability of specialist services, and them being vaccinations and screening, and that being very fragmented. Patient transport didn't always match the appointment, or you had and the difficulty when you even got to the mainland of getting from Land's End to Trelisk was often takes a lot of time and was difficult to navigate, and then get there to find the clinic had been cancelled. We'd heard that a couple of times, which was really poor. They were really looking for increased services on the islands, especially on the off islands. So what can we bring across rather than getting people to come to the services? They wanted to look at how can we reduce mainline trips for what people told us were trivial. So people being called over for a follow-up where literally the consultant said, oh, you know, everything's fine, and 10 minutes. So they've travelled all that way for a 10-minute appointment. So we heard that. We were saying, what can we do differently around that? And then a central way around people receiving information, especially around those preventative measures. They were really looking, saying that we would really want to do that. So that's kind of run through about what we heard and the themes. I was hoping Chris was going to be with us to kind of some of the things we're already doing that, but perhaps we could bring that back as an update, Chair, at a next meeting, because there is quite a lot around, particularly around that coordination around transport and around appointments on the mainland. The neighbourhood teams have just gone out to advert for a care coordinator. He will do all of that piece for the islander and be their person. So I think that's about all I was going to cover, if that's all right, Chair.
Yes, I'm sorry not to be here for that weekend. I would, few days, I would have enjoyed that, and very grateful for you all coming, and especially for going to the off islands. Right, any questions, Councillor Williams?
I think
Ewan, did you want to ask a
no,
sorry, Councillor Williams.
Okay. Right. So yeah, I agree. I think it was well promoted, well attended and well received. I think I saw there was 150 participants, which from a population of our size is very good. I'm really pleased to hear about the partnership working carried out with other council services to increase the attendance and the outreach that was done. I picked up on the smoking figure quoted in the report. Our local figure is over double the national rate. Perhaps we can pick up on that, but it's I don't know if that's an outlier or something we need to be doing more work to target. It'd be really good to hear more about the care coordinator role and what that's going to deliver. Access to transport is clearly a challenge. It's been a challenge for a long time. It's going to be a challenge for a long time coming up. But we did have a patient travel group that was hosted by our local health watch. Things have obviously changed in that area, but it would be good to make sure that patient travel partnership conversation carries on in whatever form the future looks like, but I'd hate to see that lost. There's some really good positive feedback. I know as councillors we are masters at jumping into the negative feedback, but there's some really good positive feedback in terms of frontline service delivery. And I think it would be remiss just not to mention that since this has been done, the Integrated Health and Social Care Unit has opened, which is a massive milestone for our community. One of the comments on the St Agnes feedback relates to SWAST and the communication system between someone calling 999 and that system then being fed to the first responders on the off islands. There's been a lot of email traffic about that. From what I hear, that's been going on for years. It's not just in the last few weeks or months. And it scares me that because of mobile signal and mobile coverage, which is weak over here, we could have patients in need not getting the service they need in a timely way. So I'm minded to think we need to intensify our work on that. I don't get the impression emails are giving me the assurance I need that the system is fit for purpose. So I think we need to dig into that much more. I think, Juliet, you talked about fruit and veg being an issue in the winter. I couldn't buy a loaf of bread for, well, last Saturday I think it was. It's not just for winter now that you can't buy fruit and veg. It's midsummer too. So again, it's a real fair complaint. As I've said before, I could buy a bottle of gin, I could buy a bottle of whiskey, I could buy cigarettes and vapes, but I couldn't buy a carrot. So that's something which, as a community, is really not good enough. And then my further points were, I think there's a note about you said we did. I'd really like that to happen. One of my concerns across the council consultations, we're great at asking the questions, but I'd like to think we get better at feeding back. So again, what do we do with this data now? What do we do as system leaders to make sure that we ask people the question, and when they tell us, and we know from living here that what they're saying is true, what do we do with that? How do we now process that? How do we escalate concerns? How do we reassure? How do we feed that back? So I think that would be my main question to those involved. The data is really good. There are very few surprises in there for me, but what do we do with it now?
Thank you, Councillor. So there was a number of actually points in your thing I just kind of like to go back to. So within the appendix pack, there is a piece around that proposed care coordination role. So if that's helpful, I think that gives you a bit more detail about what that person or people, because it may be more than one. I think they're looking at two part-time roles actually to give that coverage for sickness and leave, etc. So that is in the pack on slide 20, I think it is in the pack. Lucy, do you want to talk about how do we keep people engaged and our ideas about feeding back to people? Because I think that's a really valid point. There's no point in you telling us if we don't tell you what we did. So, Lucy.
Thank you, Julia, and some really good important points that have been raised. So thank you for reading all through that and coming back with some really important areas. You're absolutely right. People get really annoyed. They keep saying, "We've already told you this. What are you doing about it?" So for us, we're really committed to doing that, and I'm really welcome to see Debbie and Matthew on this meeting, because we really want to work closely with them to do some real practical next steps, especially given that Healthwatch Cornwall will be representing Healthwatch Isles of Scilly going forward. That happened from the 1st of June, and we're really pleased because I think that real presence of what we do next is going to really matter. People really wanted to keep talking to us and have an ongoing conversation, and although we only visit once a year, that doesn't mean we can't keep talking and communicating to people throughout. And so some of the practical findings suggest that about setting up a way that we have a feedback mechanism on the islands, and that will be two ways, so people can tell us feedback and we can feed back to them. And there was also great ideas about perhaps establishing a wellbeing communications tool. Now that might be a mix of different things. It might be something that's printed quarterly or twice a year. It could also be a WhatsApp or a Facebook group, so that we can really reach out to everyone across the off islands and the main island. So that's some of the work that we'll work with all of our colleagues and to develop, as well as the local authority, because you also have a great job of having to communicate as well. One of the things we're working with Katie on is potentially writing to all residents to send them our survey, and that will give us more reaching out to more people and help us to co-design what would work for the islanders in ways that they would most like to receive information and have that two-way engagement with us. So it will come, and I'll keep you all posted as we work together on this.
Thank you. Kate.
Thank you. I just wondered if we could take a minute just to welcome Debbie to the group on behalf of Healthwatch Isles of Scilly. Obviously, I know, Debbie, it's quite new, hot off the press, but I wondered if you just wanted a minute just to pick up any of the points, and possibly particularly Councillor Williams' point about we used to have a patient transport group. What are your plans for how you're going to reach out into the Isles of Scilly?
Thank you very much, and good morning to everyone. Just as an introduction, Debbie Gilbert, I'm the Chief Exec and Executive Director at Healthwatch Cornwall, and I'm pleased to confirm that from Monday the 1st of June, Healthwatch Cornwall formally commenced delivery of Healthwatch Isles of Scilly, following agreement with the Council of the Isles of Scilly and approval from Healthwatch England. We have successfully secured the necessary Healthwatch England trademark licence and have completed the operational preparations required to ensure that the service is accessible, compliant and operational from day one. However, as you're aware, Healthwatch also Scilly closed at the end of March, so there has been a dip or a gap, and a lot of information and sort of networking has been lost. However, we have an agreement with the Council of Isles of Scilly. We will operate as a distinct statutory arrangement, separate from our role as Healthwatch Cornwall, whilst benefiting from shared infrastructure, governance, quality assurance and operational support. And it gives, I think the service will provide the residents of the Isles of Scilly with an independent route to be able to share their experiences of health and social care services. They can raise concerns and identify barriers to access, and also provide information and signposting. So our delivery model has been intentionally designed to be proportionate to the geography, the population size, service footprint and the funding envelope available, whilst ensuring residents continue to have access to an independent health and social care champion. So a part of the work that will be, as Lucy quite rightly said, will be working with the wider system. We will gather and analyse resident feedback and experiences, and we will represent themes and issues affecting the residents of Isles of Scilly. We're working constructively with providers, commissioners, local authorities and community partners, and support transparency by providing insight and evidence. And our aim is to amplify the voices of those residents within the system-wide discussions. So we're keen to establish strong working relationships with partners from the outset, and would welcome opportunities to understand current priorities and emerging challenges, and which may affect the residents of Isles of Scilly. So we would be grateful for if anybody could share the relevant information with us at Healthwatch Cornwall, and I look forward to working collaboratively with you all. Thank you.
Councillor Williams.
That's really good to hear. I'm just thinking how we do that practically. I'm sure that it would be very easy for the likes of Councillor Mumford, myself, a couple of other members, to sort of have some sort of Teams meeting with officers. Katie, I'm sure would be up for that, but it would be great to have that conversation in the short term, and pick up on some of the work which we were doing locally and which we would like to focus on. And then equally how members of our community, if they've got concerns or anxieties or things to feed up to you, how that process works. So perhaps outside the meeting we can get that sorted sooner rather than later.
Yes, thank you very much. I would welcome that opportunity, and I look forward to meeting with you soon.
Yes, I think the residents are going to miss face-to-face with Healthwatch, especially if they're complaining about something. I don't know how we can get around that, whether we're going to be available. Maybe the lead member for adults and the lead member for children could help there somehow. As Giles said, we need some discussions, I think, with you. Perhaps you could arrange that sometime, could you? Okay. Thank you. Is there Kate?
I do have a point, but Debbie does have her hand up.
Sorry.
Yes, thank you. Thank you, Chair. Yes, I'm sure that you're very aware of the funding, the reduction in funding, which doesn't allow us to have a permanent presence on the islands, and that's very unfortunate. And I think discussions should have been held, way before now. But I think hindsight's a wonderful thing. We will do our very, very best to ensure that we're connecting and networking, talking with the residents. We do intend to come out to the islands. We cannot possibly represent them unless we come out and see who we're representing, maybe some workshops, but that's in the planning. I can't confirm anything at this stage, but we will do our very best. We've all developed our social media and our website, which is a route into talking to us, but further discussions, I'm sure, and that planning will make something work. Let's put it that way. Thank you.
Thank you. Kate.
Thank you. So I didn't introduce myself earlier. I'm Katie Ash. I'm Director of Public Health for the Isles of Scilly and Assistant Director of Public Health for Cornwall. I just wanted to pick up on some of the what next, because I think that's a really important part of what we do, and I think we're all committed to trying to make sure that we take what we heard and do what we can with what we heard. So I really like Juliet's idea of coming back. So I think maybe for the next Health and Wellbeing Board, we could really focus on what we've already done and what are we working on from what we've heard, because that should give us enough time to be seeing things going forward. But then I also wondered about doing a regular update slot here from the INT and just creating, so the INT, is the Integrated Neighbourhood Team. So as you're aware, the Isles of Scilly has its own Integrated Neighbourhood Team, and we've got a great team of people working locally on that. And I wonder if we just gave them a more regular slot to sort of talking about what's changing, what are we doing differently here. It would be a good link between those two pieces of work. I think I can see Juliet's giving me thumbs up. So we can work in the background to make sure that gets a more regular agenda slot, because that really brings to life what we are trying to do and how we're trying to make sure that health services in particular are working well for local residents. And then I just wanted to pick up on smoking. So Joel, I was really surprised by that smoking figure. And I have sort of tested the theory around, as I've been talking to people, like, do you feel like more people smoke here? And I've had really mixed sort of opinions on that. So two things. One, I just need to get to grips with how that data was presented and make sure that it's correct. But secondly, at the moment, we do have a gap in our stop smoking provision for the Isles of Scilly, which we were aware of and we are trying to work to remedy. So I do think we also need to make sure that we have appropriate provision in place to support people to stop smoking, and we do have a gap in that. So just to highlight that, and that's something that I am looking at in my role. The fruit and veg issue is obviously a much trickier one, but not something that we can't do something about. And I think we do need to be looking more about sustainable food systems, and I think we can work over the next year with Cornwall, who are also looking at their sustainable food network. Slightly different challenges for the mainland than there are for the islands, but I think by working together we could probably start to unpick some of that. So again, I think that needs to be a focus going forward. That's it from me, thanks.
Thank you, Katie. Are there any more questions for this? We take the recommendations that members note the feedback and initial findings from the Isles of Scilly Neighbourhood Health and Wellbeing Engagement, May 2026. That members support continued joint working with all partners as part of the Neighbourhood Health and Wellbeing Delivery Programme to review the findings and identify next steps to improve local health and care services for inclusion in the Neighbourhood Health and Wellbeing Plan. Could I have a proposer, please? Thank you, Katie. And a seconder? Councillor Williams. All those in favour? That's unanimous. Thank you very much, and we'll look forward to an update in the next meeting, which will get that on the agenda. Thank you. Agenda item 6, discussion paper on the health bill. And I think that is Katie Ash, please.
It is. Thank you. So this is probably just a brief update, but really happy for any further discussion if necessary. So the health bill is going through Parliament at the moment. This is about the modernisation of health services. A number of proposals are made in that bill that will change the way that health systems work. So I just wanted to draw some of those to the attention of the Health and Wellbeing Board. There are several things that that are due to happen as through that bill. One is the abolition of NHS England, which will change the way that both national and local NHS systems work. There is the abolition of Health Watch, which is proposed within that, and there is the abolition of integrated care partnerships. So as you'll be aware, we have the Isles and Scilly and Cornwall integrated care partnership, which happens at the committee in common. That would go in future models. The bit that impacts on this board slightly more directly is the abolition of health and wellbeing strategies. The bill proposes that health and wellbeing strategies will be replaced by neighbourhood health plans. Now, I am a big advocate of neighbourhood health, but it's a slightly different thing, and a plan is not a strategy. So there's quite a bit to work out in that, and I just wanted to kind of highlight to the board that it will slightly change the way that we work as a health and wellbeing board. The bill currently states that the neighbourhood health plan will be signed off by the local authorities and the ICBs jointly, not the Health and Wellbeing Board, which is what we were expecting. But obviously there are a number of changes that might happen as the bill goes through Parliament. The other thing that I just wanted to highlight is that it further kind of amplifies why the joint strategic needs assessment is very important, because what it does continue to do is ensure that all health and social care partners pay due regard to priorities that are outlined in joint strategic needs assessment. But it sort of takes out a layer, which is the health and wellbeing strategy. So normally we would take our joint strategic needs assessment and go, these are our priorities, we'll put those in our health and wellbeing strategy, and then all other local plans have to look to the health and wellbeing strategy. In the new system, that would be more focused on the neighbourhood health plan, but that's a plan and is more focused on a delivery model. So I just wanted to make sure everybody felt well sighted on the potential changes. My plan would be to bring back a further paper once we actually know exactly what remains in the bill, because as you know, these things can change. We just need to keep it under review, I think, for now. So that's all I was planning to say. Very happy to take points from other colleagues who may have a view on what it means or any questions.
Thank you, Katie. Katie, Councillor Williams.
Yeah, for me, it sort of presents an opportunity, and I think that's probably my interpretation, is it's underpinned by a very strong partnership between the ICB and the Council in terms of much of this to make it happen. I just wanted to clarify, is a neighbour, I think I know the answer, but I'll just check. So a neighbourhood health plan, would that be specific to Scilly? It wouldn't be Cornwall and Scilly, it wouldn't be a part of Cornwall and Scilly, would it be just us, was probably my main question. But for me, that sort of final sentence about, for the Isles of Scilly Health and Wellbeing Board, the key task will be to ensure that local priorities, local voice and the realities of island life continue to shape future system decisions. I think that's sort of a very pertinent sentence that I see the Health and Wellbeing Board having to keep that focus on. But yeah, it's how we get that link between the ICB and Council and other partners, and just clarifying that, what is a neighbourhood?
I mean, what is a neighbourhood is a very good question, because I think we probably would all answer that differently. So I would, Juliet may well want to come in as well, but at the moment, we are working locally jointly with Cornwall. So the neighbourhood plan that is being developed is for Cornwall and the Isles of Scilly. So there's a blueprint that's been under development, and I've been really involved in that on behalf of the Isles of Scilly. So that is the plan at the moment. And I'm going to stop talking and let Juliet come in, because I'm sure she'll have a view.
Juliet.
Thank you, Katie. Thank you, Chair. So neighbourhood health and wellbeing, because that's how we are positioning it. So it's very much beyond health. It's not just health, because if we don't look after our wellbeing, then we're trying to move that dial, aren't we, from sickness to prevention. So there is, as Katie said, a blueprint for Cornwall and the Isles of Scilly. It's a very high level, almost a principles document, but the island will have its own neighbourhood health and wellbeing plan that is based on the needs of the islanders. So a lot of the feedback we've got will go into that plan. So this is what people have told us, and this is now how, as a collective, because neighbourhood is everybody. I think that's a really important thing to just, it's not a new thing, it's everyone, but it's working together in a much more collegiate, collaborative way with almost breaking down those boundaries of handing things, it's yours, it's mine, no, it's our problem to solve, and how do we do that? And a lot of the work that colleagues in the team that have got together, so Darren, I know that you've been part of those sessions, and there's Chris Mitchell, colleagues from Cornwall Foundation Trust, but people from the local authority, people from our SWAS colleagues, coming together. So if this is a problem, how do we think collectively we can do something different, which is improving the outcomes for people who live on the Scilly? So that work's already underway. It's not done. It'll always be iterating, and that's why it's so important to keep asking people what their issues are, because it will change over time, won't it? And you need to really understand what people are concerned about and their issues. So neighbourhood for me, in the simplest way, is a group of public sector and across all our partners with our communities working together to improve health and wellbeing outcomes, in a nutshell. Does that help, or have I confused people?
I know it helps me, and it reassures me that Scilly's data wouldn't necessarily be amalgamated with St Austell or Buttes or Saltash's when we're doing some of this work. So I think that's positive from what I heard.
Thank you. Are there any more questions, Katie? No? Right, take the, nobody up there? No hands up? No. Take the recommendations that members note the emerging implications of the Health Bill 2026 for the Isles of Scilly. That members support further work with system partners to assess the local implications and bring back a further update when national proposals are clearer. Could I have a proposer, please? Councillor Williams, seconder. Councillor Rogers. All those in favour? It's unanimous. Thank you very much. Right, agenda item 7. Health Protection Committee Annual Assurance Report. Which author is going to present this? Ruth Goldstein. Good morning.
You're on mute.
You're on
Ruth.
mute.
Sorry, I try not to put myself on mute because I always forget to take myself off mute. Yes, I am the Assistant Director of Public Health for Cornwall and the Isles of Scilly, with the overall responsibility for all of our health protection. And obviously you've had the whole document. I guess 2 things to note. First of all, the data, the report is for 24-25. So we're working on the next report now, but the national data that's in there and the verified data that's in there only comes very late in the year. Hence, the assurance document is always at least a year out of date. So that's one thing to note. The other thing to note is that clearly the issues that are raised in there and the figures that are in there are a collective for Cornwall and the Isles of Scilly, where we present data for Cornwall and the Isles of Scilly and not just for Cornwall and then the Isles of Scilly separately. It is part of an assurance framework that we go through, but I wondered whether more useful for you as a committee might be that I've done a bit of a presentation for you around sort of how health protection generally is supported for the Isles of Scilly population. And I think that might be a little bit more useful because it might help put all of what's in that assurance document in a little bit of context. But I'm happy just to take questions on the assurance document and then go through my presentation, whatever works for you.
I think the presentation first would be best. Any questions?
Okay.
Thank you.
I think she just managed to take us out. Ruth, you've gone. Just bear with us just for a second whilst I get Ruth back.
Sorry, I'm back again. In my desire to be efficient, I became very inefficient by clicking you off instead of sharing my screen. So I will now share my screen and I apologise for that. Is my screen sharing yet?
Yes.
Good. I'll just put this on slideshow. Okay, I'm not sure it's going to let me put it on slideshow for some reason.
Bottom right, Ruth. Go down to the bottom of your screen and there's that little, that's there, go left slightly.
Ah, there it is. Okay. Perfect. Okay. So I can't see you now, but please just ask any questions as we go along, or wait till the end, whatever sort of supports you. So this has been put together by me and my colleagues from the Cornwall team, who actually support all of the health protection issues across the Isles of Scilly as well. So I just want to make that clear. You've actually got access to the three of us if we're ever needed for situations and advice on the Isles of Scilly. So we've kind of tried to break it down to give you a little bit of understanding about how the whole system works. So the Isles of Scilly obviously form part of what we do within our health protection work, and you are included in our health protection committees that we do with Devon, Cornwall and the Isles of Scilly, which is our assurance committee that happens on a quarterly basis. So any issues that are relevant to the Isles of Scilly are addressed through that committee, and that is absolutely an assurance committee. You're also very much embedded in the whole peninsula-wide governance arrangements. So that is in Cornwall and the Isles of Scilly, we have a health protection board, which used to be very active during COVID times. And I know we used to get members from Isles of Scilly attend then. It's been less well attended over the last couple of years, but we're just about to revamp it and start again. So you will be getting invites specifically to come along to that. You're also included in the local health resilience forum and the local health resilience partnership. And they're really the forums and the frameworks that do the bigger pieces of work, where they help with things like the pandemic preparedness, and were very instrumental when it came to our pandemic response for Cornwall and for the Isles of Scilly and across the whole peninsula perspective. What we know though is that what we do, the island context for the Isles of Scilly, is very different from what happens in Cornwall. And so what's really important and what has been slowly developing is an adaptive system which works for your residents and for your population and uses the resource which is in the whole system, because clearly, you know, the Isles doesn't have enough local support to do everything on their own. So things like the fact that the school-aged immunisation team don't do their work directly for school-aged children on the island, but all of that school-aged immunisation programme is operated through your GP services, and that has been going for a number of years very effectively, as I understand it. In terms of emergency planning and preparedness and sort of system resilience, that's where things like the local resilience forum and the emergency service, the JESIP, which is the Joint Emergency Service Interoperability Principles, that's where all of that comes into play. So that hopefully gives the Isles of Scilly some broader support from across the whole system. But whenever we do anything, any exercising through our emergency planners, etc., they will always try and include representatives from the Isles of Scilly, so that any preparedness, any exercising we're doing, everybody across the system, whether it's Cornwall or the Isles of Scilly, have the same opportunity to attend and to develop local plans. But, you know, point 4 there, we are aware that the Isles of Scilly are still very dependent on the system-wide expertise for things like infection prevention and control and outbreak response. So I think a few weeks ago, I was called into a meeting around an issue at the care home. It was actually very simply sorted, but your frontline staff will contact the United Kingdom Health Security Agency if they have a communicable disease, something like scabies or a norovirus issue, and then they will come to us for sort of local information. So that from my perspective, works well because I hear from some of your frontline staff on a not regular basis, but I do hear from them. So I'm hoping that means that they know the system and understand it. But we recognise that some of the issues, and at the moment we're going through, as the ICBs are clustering, we are going through some issues of trying to make sure that we have enough infection prevention and control support for settings as well as at a strategic level through the ICB. And we know that those will all sadly be amplified for your island community, so need to be taken into consideration. Point 5 is about the just the sort of we recognise that the sort of risks that happen for the islands, and that, you know, the fact that you are a group of islands, the fact that you're dependent on travel, etc. And also the fact that you do have huge fluctuations in your sort of population, particularly due to tourism, does add a sort of an extra layer to some of the complexities. So at the moment, for example, we are noting that measles as an infectious disease is slowly moving down the country. Now it hasn't hit Cornwall yet. It's only just really starting to come into the whole of the southwest. But we know when we get into the summer and we have a lot more movement of people coming into both of our areas, from say London and the Midlands and the northwest, potentially unvaccinated individuals from those areas could be bringing those infectious diseases into our communities. Because of our fluctuation and our high dependency on tourism. So we just bear that in mind in all that we do, but it is obviously an added complexity on the islands. And then the point 6 was really just to give you some assurance that your needs and issues are also considered around sort of climate change and environmental risk. I don't sit on these particular groups, but it all comes under the sort of health protection and things we need to consider. So there is, you know, your points are included, and things like the neighbourhood working, particularly on the Isles of Scilly, will really be helping with that shift in reliance on carbon intensive secondary care by bringing much more care closer to home, which is obviously really useful for many a reason. We know that we have inequalities in all of our work. So in a minute, I'll talk you through, and you'll have seen in the report that, you know, overall our sort of screening and immunisations data for Cornwall and the Isles of Scilly is really good. And we, you know, we're meeting the national targets in some areas. We're sort of leading the numbers for the southwest, like cervical screening. But behind those numbers, we also know that we have pockets of poor delivery. So we have pockets of our population who aren't accessing some of the screening and immunisation programmes, which would be useful in terms of health protection. And that is the same kind of issues on the Isles of Scilly as it is for Cornwall. And therefore we do things to try and highlight with those more marginalised groups of our population, to try and do communications with them through a host of different ways, so that they do have equal access to all of the screening and immunisation. And just speaking very briefly to Katie earlier today, you know, I recognise that for breast screening particularly, that is one of the screening programmes which the islanders do have to leave the island, and it can be a whole day out, if not more than that, just for a breast screen. And I wasn't aware. I knew that they had to come over to the mainland. I wasn't aware about the sort of the whole of the travel implications and the life disruption that causes, and it's definitely something that we can start to look into with our providers to see if there is I'm sure there won't be a local response actually on the island, but we might be able to look and see whether we can get something closer to the airport, for example, if that would be more useful. So under overall screening and immunisation, we are performing well across Cornwall and the Isles of Scilly. What we have to recognise, though, is we do not get any routine data just for the Isles of Scilly population, and this is a real bugbear. And no matter how many times I raise this with the national teams, they are just not able to break down the data that they get in to give us the island perspective. And a lot of that is because the numbers are so small for your population. So the number of people who are having bowel screening, breast screening, cervical, AAA is actually too small to be able to not give a sort of anonymized data. So therefore it's not collected at that level. But we assume that the issues we have locally in Cornwall with pockets of our population not accessing these services will be replicated with those similar populations on the Isles of Scilly. Again, our immunisation data is relatively good as well, and we know that we are getting fairly good coverage, but it's never, you know, we're not complacent, and we have something called the Maximising Uptake of Immunisation Programme, which we run with the NHS on an annual basis, and we look at areas where we see there is real variation in uptake of our vaccines. And we try to do very specific targeted work to try and increase the uptake for those vaccinations. And I've listed the vaccinations which we are particularly concerned with at the moment on the slide so that you can see those. So just to sort of summarise, we know that where we see gaps in the health protection service for the Isles of Scilly, the first one is definitely about the data and the visibility of your specific populations. And I will keep banging the drum on that nationally, regionally with my colleagues to continue to see if there are other ways that we can get around it. It will all be reported, individuals' data will all be reported back to the GP, but that then would require us to set up quite a complicated system with the GP to collect the data around all of the people eligible for breast screening this month or this year versus all of those who did actually accept the screening programme. So it's not a straightforward solution, and I don't know whether we will. I'd like to think one day we may be able to crack it, but I'm not entirely convinced. We also know that we need to be very cognizant of the fact that infection prevention control and the capacity to give support onto the Isles of Scilly. There are occasions on the mainland where we actually have to send, for example, an infection prevention and control nurse into a early years setting where there is an outbreak of something, and that can happen relatively easily on the mainland, although that's going to be more challenging as the cluster arrangements get in place. But luckily, so far, we've not had outbreaks of that nature on the Isles of Scilly, but we will, if we have an outbreak which needs some eyes on from an infection and prevention and control expert, we will need to work around what the system currently is. We know there are some structural barriers for the immunisation and screening programmes, you know, like having to come to the mainland, and that is something that we need to keep working on. We know that you're reliant on the mainland for a lot of surge capacity if we have to provide extra support, and that became very evident when we were going through COVID. Personally, I spent quite a lot of time working on the island's response for you and with you, and making sure that you had all of the correct prevention and containment structures and advice in place. And we try to include that as everything comes out. We try to include you in all of the additional comms which we send, for example, to try and encourage people to make sure that their MMR vaccine status is right. So those are the key gaps that we see at the moment. It'd be great to hear from your perspective what you feel on the island to make sure that we're working on the right areas. I thought I'd just leave you with this slide here, which just kind of tells you, particularly for your screening programs, what the situation is, and where people actually and how they get them. And you can see that for pretty much most of them, a lot of them, we've managed to get a workaround that makes it less inconvenient for the for the island population. The big one which is problematic is the breast screening, because that is the one where people have to leave the islands to actually go for their initial screening. And as I said, we're aware that is really quite a time commitment. And then finally, I just thought I'd give you a slide to sort of show you the types of things which we do get involved with or have got involved with over the last couple of years on your behalf, as well as the sort of really routine comms which we share with your comms team as well. These are the kind of areas where our health protection team specifically have been involved in. So that gives you a bit of an idea, and I'm really happy to share these slides with you afterwards, because I appreciate that's an awful lot of information in a relatively short time. But hopefully that gives you some assurance that you know, that we are working with you on your behalf and trying to do sort of the best we can, but always really keen to get as much feedback as possible so that we can provide even more sort of locally orientated and supportive work around health protection. So really kind of over to you. I hope that's useful.
Thank you very much, Ruth. Yes, it would be good if you could share the slides with all of us. It would be helpful.
Yeah, I certainly will.
Thank you. Councillor Williams.
Yeah, I'm really grateful for that presentation. I confess I did start reading the report and was a bit underwhelmed by some of the long words in there, so the presentation really made it much more useful and meaningful to me. Again, yeah, I share the disappointment that the data for Scilly isn't necessarily available, but I guess we can triangulate against some of the feedback from the likes of the consultation response we discussed earlier in the agenda, which is useful. I was reassured to hear about the Isles of Scilly being very much on the radar for some of those weather resilience, climate change challenges which we face. We've got a Storm Goretti briefing as members in a few weeks, so it's good to make sure that those sorts of things are fed in. You talked about measles, Ruth. Is that something that should be keeping me awake at night? Is there anything we can be doing to mitigate that? Is it
measles keeps me awake at night as well, so I can totally get that, Councillor Williams. Should it be something that does keep us awake? Maybe not. We have relatively good uptake of the measles vaccine amongst our population in Cornwall. However, we do know that there will be groups who, particularly in the 1980s and early 90s, didn't have their measles vaccines because they were concerned about the MMR and the link to autism. So we've been doing a lot of work through the GP practices to try and get information out to people, to our population, so they understand the risks and of not being vaccinated, trying to encourage people to go and look at their vaccine status, even if they're 30 and 40 now, go and check out whether you've had it, and then asking the GPs to do catch-ups on behalf of residents. So we're doing an awful lot, and every time we look at the data across Cornwall and the Isles of Scilly, we see that more and more people are being vaccinated, because my biggest concern is that it will come down on somebody on holiday from London who won't realise that that's the rash they've got. They'll go to numerous, you know, events and parties and beach things, and then if they happen to find somebody who's not vaccinated, that measles spreads really easily. So that's the problem. We have across the country now got tried and tested ways of trying to contain an outbreak once it happens, but measles is so contagious that it does flick through populations who are unvaccinated. So I don't think it should keep you awake. I think we all just need to keep on the bandwagon of, you know, measles is still very with us, and if you're not vaccinated because you chose not to be, or you were worried at the time, it's never too late to get vaccinated.
Thank you. Any more questions? Sorry, who? I can't see. Darren.
Thanks, Chair. Ruth, do we have any data on the number of residents that are vaccinated versus aren't vaccinated with MMR, etc.?
Not for, no, we don't. So the data we get is around the school uptake of the and sorry, not the school uptake, that's not MMR, sorry, I'm thinking about HPV. Ignore that. The data we get is the GP data about how much of their populations are not vaccinated. So what we've done is we've gone through the GP practices across the Cornwall and the Isles of Scilly to see where we've got the least vaccinated. And it has to be said, you know, in some areas we've got 60% of the eligible population who should have been vaccinated. In other areas we've got 90%. I've got to confess, I haven't looked at the Helston practice data before this meeting, and I probably should have done, so apologies for that. But of course, what we won't know is whether I've got a feeling Helston isn't one of our hit practices. It's not one of our really low uptake ones. But what we won't know is how many people are Isles of Scilly residents and how many of them are Cornwall residents. That's our, which is why we you know, if they have got a lower uptake, then we'll be throwing everything at them so that they deal with that whole population.
Yeah, I think it would be useful to know, though, if we're an outlier. And anecdotally, I think from what you're saying, it sounds like we might be. And given the risks of an outbreak on the islands, which are probably heightened versus the mainland, I think it's probably worth something exploring, isn't it?
Yeah, no, I will have a little look at that and just make sure that my team are doing what they need to do with the Helston practice. As I say, I've got a feeling it's not one of our real worry practices, though, but I will check that out.
Thanks, Ruth. Thank you.
Yeah, get this one down. It's you. You've done that one, yeah. Finish now.
Because my glasses, this one, go to number 9.
Go that one next, right. Yes, thank you very much. I'd like to take the recommendations for the discussion paper on the health bill. Recommendation 1, that members note the emerging implications of the health bill 2026 for the Isles of Scilly. Recommendation 2, that members support further work with system partners to assess the local implications and bring back a further update when national proposals are clearer. Could I have a proposer, please?
Councillor Mumford, sorry, we need to do, it's the wrong paper. That's because I distracted you just as we were going to that item. We need to do the recommendations for the health protection paper.
Have I got the wrong one?
Sorry, I threw you, just trying to, just for other members of the board, we're just going to change the agenda around slightly whilst we're Cora, because a member needs to leave.
Okay, so we go to agenda 9 now.
Yeah, but I think you need to do the health protection report recommendations sign off first, so we just need to, sorry,
So we just
Mumford.
go to, I'm on the wrong thing. What page are we?
Ruth, you're still sharing your screen.
Oh, I am still showing my screen, you're right, sorry.
I'm sorry. Yes, I've got it now. Sorry, recommendations that members are assured that effective health protection arrangements were in place throughout 2024 to 2025 across Cornwall and the Isles of Scilly. Could I have a proposer, please? Councillor Rogers, seconder, Councillor Williams, all those in favour? Thank you. Sorry for that, a little bit. Getting confused.
Sorry, my proposal was then that we move to this, the Safeguarding Adults Board annual report whilst we're Cora, and then I think the other papers will be fine after that.
So we now take agenda item 9, please. That's Fiona Field, please.
Yes, it is. It is. Online. Hello.
Yes. Hello, good morning.
Sorry, I can't be with you this morning. But anyway, it's great to be back here on Scilly, even if it's remotely. I have a colleague with me, Lindsay, who's going to share the slides. There are just a few slides for people. Really welcome questions. We do have some data. It was referred to by Ruth is the sort of lack of data for Scilly when you're a shared resource like our board is. This annual Safeguarding Board report is a shared report between Scilly and Cornwall. However, we have pulled out some data specific to Scilly because I know obviously for councillors that is what is particularly pertinent to you. And I see we have Sue here as well as the director this morning as well. So Sue will probably want to intervene from time to time. So without more ado, I will go through the slides. These do feel very historic now for members because this is the annual report from last year, looking back to the previous year. We are now just at the tail end of writing this year's annual report, which is obviously 2025-26. So my apologies, this is the current annual report, but it is actually quite old news now. Nevertheless, you haven't heard it before, so I will go through it. We are a statutory board for members that don't know, under the Care Act of 2014. Adult safeguarding boards have to be established under local authority footprints, and clearly for yourselves and Cornwall, that's a shared footprint for the purposes of safeguarding. And I would say I'm the independent chair. It actually works very well both for Cornwall and the Isles of Scilly as well. So it is a combined report. However, the strategic priorities, as you can see there, which are going to run for another year to 2027, those are the strategic priorities of safeguarding adults across yourselves as the islands and clearly the mainland of Cornwall. Drawn from our experience, I've been the independent chair now for unbelievably coming up for 9 years. And this is the third set of priorities that we've done, learning from what's happening in Cornwall around keeping vulnerable adults safe. So those are our priorities. Lindsay, the next slide, please. Okay, that's what we look like. I'm not going to go through it all with you unless you specifically ask me to. We have a board at the top, which I referred to as the SAB, the Safeguarding Adults Board, shared with yourselves and Cornwall. And underneath that, we have quite a tight governance arrangement of an executive group, various working groups that do the detail on pieces of work that we want to do. As you can see there, we have several of those. Sometimes we set up a task and finish group to do a specific piece of work on something that may have cropped up in Cornwall that we hadn't perhaps anticipated. And most importantly, we do a lot of engagement work. So we don't have our own engagement group for safeguarding adults. I think that's nearly impossible for individuals to represent 565,000 people in Cornwall and nearly 3,000 people in Scilly. We go to groups that are already established to engage with people who live and work in the islands and obviously in Cornwall. And you can see those at the bottom. Those boards are very well established, and our staff attend those to make sure that safeguarding is discussed and we listen to people's experience of being safeguarded as an adult, rather than setting up a specific group to do that. And you can see there, statutorily under the Care Act, we have local authorities on our board, the Integrated Care Board, the ICB, and the police. They're our statutory partners on the board. I'll come to who else is there in a moment. Lindsay, next slide, please. That's who we are. We're quite a big board. You can see yourselves there, top line on the right-hand side, Isles of Scilly, but you'll recognise a lot of those partners provide services on the islands as well as the mainland. And we have very good representation from our statutory partners, but also that really wide grouping of people that represent the universities, the health services, the hospital, care commission, probation, education establishments, fire and rescue, etc., Health Watch, important partner. So we are quite a big board. There are 23 people on the board at the moment. And one of the things that is really quite difficult to get the voice of is on the second line down, independent providers, because we have lots of independent providers of adult care across Cornwall and the Isles of Scilly as well. Largely your care for older people comes from your own in-house provision, but actually I know you're always quite keen to try and make that a wider market. When I've been over to the islands, we've had discussions about that. So that's our board currently. Next slide, Lindsay. Okay. We develop ourselves as we go along, look at what we do. You can see there that during 24-25, and it's continued in 25-26, we wanted to get some better governance around things called safeguarding adults reviews, which I'll come to in a moment. It's a statutory duty of ourselves to carry out reviews when things have gone wrong for adults. The famous, sometimes rather hackneyed expression is the lessons learned from that. But yes, we look at what's happened and we identify things that could have been done better and then try and change services accordingly so they don't happen again. So you'd expect us to be quite robust about how we go about doing that. Because something's gone wrong and it's important to pay attention to what that was and how to address it. And we also work very closely, the last bullet point there, with the other statutory boards which work across Scilly and the Cornwall mainland, which are the Partnership for Children and also the Community Safety Partnership as well. So we work very closely together, and I'll come to that in a moment. Next slide. So I just mentioned Safeguarding Adults Reviews, SARS, as they're known, and you can see the numbers don't look very high on this, but the work is very detailed and can be quite lengthy work as well. So we had 12 referrals the year before last. I can tell you now what we're putting in our annual report for this year that's just gone is we've had 13 SAR referrals, so the numbers are similar every year. Anybody can refer a case into our SAR process, but it is looked at very systematically. There are national criteria about what does or doesn't constitute a SAR and how you go about it. We have different approaches. Sometimes we will employ an independent author to carry out the work for us. Sometimes we'll do the work ourselves, taking out organisations that have been very closely involved, because there could be a conflict of interest in there, of course. So we have different approaches to SARS. We go through quite a robust process, and we had an audit carried out in 2024-25, which was commissioned by myself and the DAS for Cornwall at the time, with the agreement of the DAS from Scilly, to say, are we doing SARS as well as we could? And we were found wanting in some areas. So we've done a lot of work around SARS to improve our processes and how we identify learning, and most importantly, how we find out if it's made any difference at all out there in frontline services, because that's the really important thing. Has it made a difference to people? We can publish SARS. In fact, we should publish SARS. It's not a legal requirement, because locally we can make some decisions about whether we publish a SAR or not. You can see there that we actually published 4 SARs in that year. Some of the SARs, as you can see, were executive summaries. And sometimes we choose not to publish a SAR. You ask yourself the question, why wouldn't we publish a SAR? Because it's about learning. And once it's published, it's out there for the rest of the country to see those SARs and adopt some of the actions we've taken if they think a similar thing might happen in their geographic area. So it spreads the learning much wider than Cornwall and the Isles of Scilly. The reason we wouldn't publish a SAR, and in the time that I've been in post, we haven't published 2 SARs, which is a small number of the SARs we've had. Generally speaking, it is because there are children involved in the family. And of course, once you publish a SAR and you decide how much information is in the public arena, that's there forever. And we would always consider, you know, the child and the rest of their life. If their family's been difficult, it might not be appropriate to put so much detail out into the public arena. So it may become an executive summary, or it might not be published, and we'll just do the recommendations.
Fiona, if you can hear us, we have some audio problems. Just bear with us.
Okay. Shall I carry on talking? Can everybody hear me? Sue, can you hear me?
I can hear you, Fiona. Yes,
Okay.
I don't know.
I can't get any response about shall I carry on talking?
I'm not sure whether people in the room can hear you. That might be the issue.
Okay, I think I'll carry on because I'm concerned about time.
If you can,
Okay, so next slide, Lindsay.
sorry, can you hear me? It's Katie now speaking. We've got some problems with the audio in the room. Just bear with us a second.
Okay. I'll just let people read the screen. I won't go through that. It's a little bit of time there.
Fiona, I'd just like to say
Yes.
I've always really found the board and the executive groups that I attend, subgroups, really positive, and
Great.
it always feels like the Isles of Scilly are just not an afterthought, that we're engaged and SARS are shared with us, and our views about SARS sort as well. So that's it's been a really positive experience.
That's
So
good.
thank you.
Thank you for that. And actually, I would echo that for members and indeed Sue as the director, that actually from the point of view of input into the board itself and the executive groups, yes, the subgroups that you've referred to, we've always had really strong representation from the islands, which is really good. And I've been out to the islands several times in person myself, sort of thing. So it's absolutely not an add-on. Absolutely not an add-on. It's small, but it's an equal partner. So yeah, thank you for saying that, though. Appreciate it.
And just to confirm, Fiona, for members, there's not been a SAR from the Isles of Scilly.
Correct. Correct.
Yeah.
Yes,
I just think
I
that's
have.
just
Yes.
to ground that. Thank you.
I have your figures in a moment. Yes.
Okay. I'm sorry, I've jumped the gun.
No, you anticipated very well. So thank you for that. Can I continue? I'll keep going. I hope everybody's had a chance. Yes.
Sorry, this is going to cause chaos in the room. We have lost the ability to speak through the audio visual. You're on my laptop.
Oh, right.
I think what we're going to suggest we do is take the recommendations for this paper so we can approve it.
Okay.
Because we can't interact with you. Oh, that's stopped feeding back now. No, it hasn't.
Right.
So if you have anything absolutely critical that you want to make sure we hear, we can make a minute for you to do that now, and then we'll move to the recommendations.
Okay, so Lindsay, can you flick to the Isles of Scilly slide, please? It's slide 9, I think it is, or 14. Okay, keep going. Keep going. There we go. Right. Critical one for the Isles of Scilly is your data. So it's one slide. You can see there 10 safeguarding concerns were raised. So yes, the numbers of people on Scilly are very small, but 10 safeguarding concerns were raised in that year. One made it through the national criteria that I referred to become a Section 42 inquiry, which means under the Care Act, it met the criteria for taking an inquiry. Some people call it investigation further, because there was enough concern to say, we need to look at this with a safeguarding hat on. So that was taken through the process. You'll be pleased to know there are no backlogs, because very often backlogs are a concern under safeguarding if people are waiting to be assessed. And then the profile of those safeguarding concerns, you can see there the age groups are pretty much all adults. There's a little bit of a dip between 64 and 85, but largely those 10 are evenly spread across the population, and 50% decline some support needs as well. So those will have been followed up. And we have a mixture of physical and mental health vulnerabilities identified in those groups. The most common theme that's identified through safeguarding reviews is that people are abused more by far in their own homes by people who are known to them. So when I say that, I am talking about family members and or friends and neighbours, those sort of things, rather than paid workers. And that's a very, very common pattern across the country as well. So Scilly, your safeguarding concerns fall into that same pattern. It's a little bit further back in the data, but that's what it says. And the identified risks from those key data is that for the Isles of Scilly in particular, the workforce capacity pressures are very high. I don't really need to tell you that, but that reinforces what you already know, looking at it through a safeguarding lens. I can see nodding heads there. So yes, we are all saying the same thing. It is a bit better, but in the time I've been here in Scilly, it's gone up and then stabilised a bit, and then another few people leave, and it's a real pressure in the system. Because the numbers are so small, a few people make a massive difference to figures. So those are your specific data items. Now, the request to me to shorten the presentation is to say there is a recommendation. You don't have the ability as the Health and Wellbeing Board to, you're being asked to ratify rather than make a decision to accept. This has been accepted by the board, by the Safeguarding Adults Board is where it's accepted, but we take it to various statutory boards, including yourselves, to say, This is information you need to know, and therefore you ratify it for us. So that's the decision for today, is to agree, yes, this data, you know, it supports the Isles of Scilly. They are mentioned on it.
Thanks, Fiona. Sorry, okay. You might be able to hear the chaos that's happening in the room.
Yeah, I can, yes.
So I will leave my microphone on while Councillor Mumford does the recommendation.
Thank you. Yeah.
We can just propose and second to get it through.
Yeah.
Could we take the recommendation that members receive and note the annual report? Councillor Rogers, and seconded by Councillor Williams. All those in favour? That's unanimous. I'm sorry, Councillor Rogers has to leave the meeting. I'm sorry about that.
It's okay.
Sorry.
It's okay.
Do you want to do your report?
It's not that important, so therefore, actually, no, I probably do need to do it. I just don't know how.
Have we finished with safeguarding now? That felt like it was a closed item now. Yes?
Yeah, it is closed. Okay. Thank you so much, Fiona.
Thank you very much, everybody. Thanks. Bye-bye.
Thanks, Fiona.
Bye. Bye. Bye.
So I think my suggestion is that we log the audio visual out, because I'm in anyway. We could just do it from my laptop.
We'll have to post the live stream.
So therefore